Hello, I am Dr. Sharrón Manuel, and I am a reproductive endocrinology and infertility specialist at USC, which is affiliated with HRC Fertility in Pasadena. So I did my undergraduate degree in biomedical engineering at Drexel University in Philadelphia. I also completed my medical training in a combined program with an MD and PhD also at Drexel. I then went on to complete my residency in obstetrics and gynecology in Lexington at the University of Kentucky. I then wanted to get more experience in reproductive medicine, so I did complete a master's in reproductive medicine and science at Northwestern in Chicago, and finally completed my fellowship training at the University of Cincinnati in Cincinnati, Ohio. So I really was introduced to the field of reproductive medicine and infertility later in my stage in my career. I really didn't know about the field until my first year at residency during my intern year. And that's really when the light bulb went off. I was in a reproductive endocrinology and infertility specialist office working with patients, and just the connections I had with those patients and the aspects of helping them. And I've always been interested in women's health, so that was already at the forefront, but that was just the perfect marriage of science and medicine, which is a physician scientist dream such as myself. And also, I think the field is very innovative. It's constantly changing. There's constantly new technology being introduced, and that's always excited me. Well, in this field, actually, there's so many. The one that I guess really stands out is we did have a patient that had undergone multiple attempts to conceive and had multiple failed transfers using what we call euploid or genetically normal embryos. And really, we could not figure out the reason. There was no real reason as to why she was not getting pregnant. And so we were down to our, also despite our best interventions, we still couldn't figure it out. But we were down to our last 2 normal embryos. And finally, we got that positive pregnancy. And I just remember that first scan, just seeing the heart flicker, and all of us, I think, in the room were crying. And then we always have a baby reunion at my previous fellowship institution. And so we saw her, and she brought her baby girl to the baby reunion picnic, and I got to hold her for the first time, and I just looked at her and was like, wow, I was part of creating this special human. So that's just a feeling that you'd never get anywhere else. So I think everybody's fertility journey is different. I know a lot of patients can be scared, can be nervous, but we are here to help you and hold your hand through every step of the process. And because every situation is unique, I like to take an approach of personalized medicine, giving an individualized plan to every patient to address their specific problem as to why they're having trouble building a family, and hopefully partnering with them so we can reach their goal of building that family. For me, it was really the collaboration of HRC with USC. That brings the best of both worlds, where you really have this exquisite patient environment that delivers excellent patient care, but you also have the academic component that brings in the evidence-based medicine. Also, I really think it takes a team to care for our patients. And with HRC, we really take that team approach where everyone is intimately involved in the patient's care. This offers for a very friendly, but also collaborative environment, which I think is really important. I am Dr. Sharrón Manuel, and I'm a reproductive endocrinology and infertility specialist at USC, which is affiliated with HRC Fertility in Pasadena. And I look forward to meeting with you and partnering with you for your fertility and endocrinology needs.